A warning to Tasmania's healthcare workers that left no room for interpretation.
For those that refuse to vaccinate and do not have an exemption, on 30 October you will no longer be paid. And I will be pursuing termination action on and from 31 October for each and every individual case.
Tasmania's Department of Health employs around 16,000 people. It estimates 87% of staff have received at least one dose, but that leaves more than 2,000 at risk of non-compliance.
We saw this happen, and I would make the point in aged care, that it came right down to the wire.
But even if just a few fall foul of the deadline, they'll depart a system already under immense strain, even without Covid-19.
We know that our emergency departments across the state are dealing with increased demand and pressure. The loss of a small number of nurses and midwives will have a significant adverse impact on workloads and also individual impacts on nurses and midwives where they'll be required to be doing onerous amounts of overtime.
The government will release its reopening plan on Friday. The Health Secretary says the challenge of replacing unvaccinated staff is better than opening up with them on the wards.
If I have to furlough hundreds of workers like what we've seen in Victoria and New South Wales when we have COVID in our community, that will be far more devastating.
As Australia's vaccination rate today passed 70% double dose, so too did Tasmania's. And in more positive news, all but 2 close contacts of the man who breached hotel quarantine in Tasmania have now tested negative to the virus.
So that's a great news, particularly that the closest contacts, none of them have tested positive, and also that a large number of the broader circle of their close contacts have also tested negative.
The Premier says a review into Tasmania's hotel quarantine system will soon be made public, a system which potentially allowed a COVID-positive man to simply walk out of quarantine and into the community.
Security guards are not expected to grapple with people seeking to leave a hotel facility. They're there as a general deterrence.
That review will consider whether we need to treat domestic arrivals as just as much of a risk as those coming from overseas.